Time has expired. The gentleman from Texas is recognized.
Yielding myself 30 seconds, I can't help but think many Democrats are eager for everyone else to sacrifice. What about government? Why can't government sacrifice a little? All those obsolete agencies and wasteful programs, the money they spit away on stimulus programs and bail out anyone who needs it. Maybe it is time for shared sacrifice, and it can start with a big, fat, bloated federal government. This time I'd like to yield 5 minutes to a physician who has delivered more than 3,000 babies in his life, is a valued member of the Joint Economic Committee and expert on health care and many of our health care entitlements, the gentleman from Texas, Mr. Burgess.
The gentleman from Texas is recognized for 5 minutes.
And I thank the gentleman for the recognition, and it is an important debate that we're having tonight. And Madam Speaker, Madam Chairwoman, I hope that people are watching the debate, because this really does set the tone, set the course, set the compass for the future of our country. And this is a debate that really should not be partisan, although we certainly have heard some partisan references. I may even make one or two myself. But right now, intergenerational expectations are down. And in that murky environment, we now have Paul Ryan come forward and bringing us a fact-based budget that provides a pathway for America's future. Everyone knows the rising cost of health care is a serious threat, not just to our federal government, but to our prosperity in general. Unfortunately, the president last year and the Democratic majority that was present in Congress last year made the problem worse. Here's the simple truth. Instead of reforming Medicaid and Medicare and using the savings for deficit reduction, the Democrats spent every penny of savings, every single penny of savings, and then a lot more on a new entitlement program. Incredibly, they accelerated the crisis, and Medicare and Medicaid are even more in peril today than they were before this all started in 2009. They found a fire and they put it out with gasoline, and it's a surprise that it's worse. In contrast, the budget that we're debating tonight, the Ryan budget, saves Medicare and Medicaid for future generations, uses reforms to make the programs financially sustainable. Now, according to the Congressional Budget Office, the Democratic plan that we know as the Patient Protection and Affordable Care Act would increase spending by almost $1.5 trillion, primarily by expanding Medicaid and creating new subsidies to buy health insurance. The so-called Affordable Care Act would increase coverage for the insured and uninsured, provide coverage for the uninsured, but that also is going to create greater demand for health care. But at the same time, we put in constraints. We limit physician education and training. We limit testing and patents for drugs and devices. We restrict the very supply of health care, and consequently, much of the increased demand will in fact deliver us higher prices, not more services. The Congressional Budget Office and the chief actuary at the Center for Medicare and Medicaid Services, who scored the legislation, readily admit that they did not include the price effects of the increased demand for services. In fact, the chief actuary at the Center for Medicare and Medicaid Services, his report wasn't even released until 3.5 weeks after you passed the bill a little over a year ago and signed it into law. Thus, the official budget estimates understate the true cost, the amount of spending that was contained within this health care law. And secondly, the available budget estimates ignore the negative impact of higher taxes on economic growth. Almost 4% surtax on interest, dividends, and capital gains for those earning over $250,000 a year will reduce business investment and employment. Thus, the new tax will reduce economic growth and generate less revenue than expected. This problem cannot be fixed by simply raising taxes on the American people. And thirdly, the budget estimates that a 29% across-the-board reduction in Medicare physician payments in 2012 and beyond, as well as continual reductions in other Medicare provider payments, But both the CBO and the Medicare actuary have called the reductions unrealistic. In fact, Chief Actuary Foster said, if you believe this, then I've got good news for you about the future of Medicare. But we all know that the reality does not match the expectations. And then here's the other problem. The Independent Payment Advisory Board, and I've got a great deal of sympathy with my colleagues on the Democratic side of the aisle. When you passed the Affordable Care Act the first time, you did not include the Independent Payment Advisory Board because you saw through that. You saw that as a trick, a trap. And yet, when you got the bill from the Senate that you in turn felt you had to pass, it contained the Independent Payment Advisory Board. What does the Independent Payment Advisory Board do? Well, it gets 15 people, goodness knows who they are, goodness knows who selects them, and they're going to deliver to Congress a menu of cuts. We either get to vote them up or down. Sure enough, we get to participate in that, but if we vote them down, we've got to come forward with an identical dollar figure on cuts. And if we're unable to do that, and when has that ever happened in this body, if we're unable to do that, the Secretary of Health and Human Services, the following April 15th, that is tomorrow, gets to implement those cuts anyway.
I would yield the gentleman an additional minute.
I thank
The gentleman has an additional minute.
And then what happened yesterday? The president, in talking about his vision for the budget, by the way, his second vision for the budget this year, doubled down on the Independent Payment Advisory Board and said, it's such a good idea, we're going to do even more. You know, Elias Zerhouni, the former head of the National Institute of Health, talked about a day medicine is going to become much more personalized. Personalized, predictive, therefore more preventive and requiring more participation by patients. Wouldn't it be great? Wouldn't it be great, following Congressman Ryan's, Chairman Ryan's vision, that we personalized Medicare to match that personalized medicine that our children and our grandchildren are going to enjoy in the future? Instead, we're going to end up with more of the same, which is a benevolent, albeit benevolent, central planner, moving those data points around on a spreadsheet. Why not put the power back in the hands of the American people? That's what the Ryan budget plan does. We ought to support his effort and be grateful for its presence. I yield back.